Hello, my name is Sharanga and I'm one of the physician associates that work here. Can I get your name and your date of birth, please? Perfect, Neela. Hi, Neela, nice to meet you. So, Neela, I would like to take some history from you so I can understand what's brought you in today. Would that be fine? Perfect. So, tell me how I can help you today. Okay, so you're experiencing heartburn when you eat and acid reflux, so there's like a sour, bitter liquid that travels back up to your mouth, okay? And you feel bloated after meals. Okay. When did all this start, Neela? About 3 weeks ago now, okay. And is there anything else you would like to add? No, okay. So seeing that you've had the symptoms for 3 weeks, do you roughly have any sort of idea what it could be? No, you don't have any idea, that's fine. And is there anything particular that's worrying you? Okay, so you just want to stop the burning sensation and the bloating. Yeah, that's understandable. It's not really a nice sensation to be feeling. And what did you hope to achieve out of today's consultation? Just to gain a better understanding of your symptoms. That's fine. I can definitely help you with that. So Neela, we've discussed your symptoms and your and what you want from this consultation. So I would like to just ask more questions so that I gain a better understanding about your health overall and the symptoms. Would that be fine? Perfect. So have you traveled anywhere recently? No, okay. And do you have any other medical conditions that I should be aware of? Okay, so you've had asthma since childhood, but you just take the blue pump when required. Okay, that's fine. And is there any other medications or surgeries or medical procedures you've had? No, that's fine. Are you sexually active? No. And have you ever been sexually active? No, okay. Do you drink or smoke? No, that's good. Do you exercise? No, okay. And how would you describe your living situation? Okay, so you live by yourself in a flat, that's fine. Are you currently working? No, you're studying masters. Oh wow, that's amazing. And how would you describe your eating habits then? Okay, so you just eat whenever you get time. Normally it's like a late meal. So when you say late, what do you mean by that? What time are we talking about? So like around 10, okay, 10 p.m. Okay, so have you noticed any food in particular that causes symptoms? So like takeaways, fried food, and fizzy drinks. Okay. And Neela, so you mentioned again that you've had the symptoms for 3 weeks now. Have you tried anything to help the symptoms? So you've been drinking lemon water in the morning. Since when did you start drinking the lemon water? So 3 weeks ago when the symptoms started. And have they been helping? No, okay. And how are your bowel movements? Have you noticed any changes when you go to the toilet? No, everything's normal, okay. And have you noticed any changes in your weight? No? Okay, that's fine. Okay guys, so after listening to Neela's symptoms, it sounds like she is suffering from a condition called gastroesophageal reflux disease, which is also known as GERD or GORD. So the diagnosis for this condition can be confirmed by an upper GI endoscopy. However, an endoscopy should not be considered as the first-line procedure for diagnosis unless the patient is experiencing heartburn accompanied by another serious symptom or factors such as the following. Okay, Neela, so thank you for sharing that information with me. So from what you have told me, I think you have a condition called gastroesophageal reflux disease, also known as GERD. This condition is known to cause heartburn. When you swallow, the food passes through your throat and down the esophagus, also known as the food tube, and down into your stomach. A muscle called the lower esophageal sphincter, located above the stomach, controls the opening between the food tube and the stomach. This muscle remains tightly closed and only opens when you swallow something. When the muscle loses its ability to close properly, the stomach acid can reflux, so it can travel back up into the food tube, and this causes the burning sensation you mentioned earlier. Seeing as you also have asthma, you will experience the symptoms that on a higher level, as the acid reflux will irritate your airways and make them more sensitive. So in terms of treatment, I can get the doctor to prescribe you some medication which will help you with the acid reflux and the heartburn. You can also try to manage your symptoms at home through easy lifestyle changes, such as avoid eating the trigger foods you mentioned to me earlier, like fried foods, fizzy drinks, takeaways. I know it sounds hard being a student and trying to cook at the same time, but please do try to avoid them and substitute them with easy, quick, healthy home-cooked meals. If you need any nutritional advice, please do let me know. I can refer you to a nutritionist or give you some leaflets and websites that can help you. And avoid eating large, heavy meals late at night. You should aim to eat your dinner 3 to 4 hours before you go to bed. And after you eat your meals, try to sit up straight and avoid laying down. And when you sleep at night, sleep in a position where your head is elevated. So this will prevent the backflow of acid all the way to your mouth. So maybe use 2 pillows and sleep on 2 pillows basically. And avoid drinking the lemon drink you mentioned to me earlier, because lemons have citric acid, so they will just aggravate your symptoms even more, making them uncomfortable. And finally, try to incorporate an exercise routine into your daily routine. This will help you maintain a healthy weight. And all these changes will help you with the bloating, heartburn, and the acid reflux, which were your main concerns that you mentioned to me at the beginning of this consultation. Okay, Neela, I know that was a lot of information for you to take in, so don't worry, I will give you a leaflet which includes everything I just mentioned to you now, so you can have a look into it in your own time when you need to. So did you understand everything I mentioned to you, or would you like me to go over anything again? No? Do you feel like we covered all the concerns you had at the beginning of the consultation? Yeah? So do you have any questions for me at all? No, perfect. So moving forward, if you feel like the symptoms have gotten worse or didn't get better after the lifestyle changes or finishing the medication, please do come back and we will perform an endoscopy on you, and then we'll take it from there. Yeah? All right, Neela, it was nice meeting you. Thank you for your time, and I hope you feel better soon. All right, bye now.